All right, so now we're to this part where the entrant, dressed in PPE, we got our knee pads, elbow pads. I want to wear my Tech Gen or my BDUs, just something that is really as conforming as possible. I don't want stuff hanging off me. I don't want to be big and bulky because we're entering a confined space and we want to just be nice and slender and able to move through that space fairly freely, okay? I've put on a harness underneath everything, so when we do enter a confined space, we need our harness on first. I have my skate pack. We have 4 skate packs that we have. This gives us emergency breathing air. I've already bled. Not myself, but the air manifold attendant has bled our lines, so those are clear and clear. I want to confirm that my skate pack's working. So I'm full here. Turn on my pack. Check my regulator. We're good. Shut my pack off. Okay. This has another one-way valve in it. So once I open this, it's not going to equalize to the pressure that the bottle is. It will stay at the pressure that it initially started at. This gives me 5 to 10 minutes of emergency air to breathe. We have our air communication little whip line here. I want to have this leash or lanyard attached to this back end here. I don't want it attached to the front end. And that, for that reason, is because when this gets moved around, I don't want this line to kink. When it's attached on the back end here, it holds it in place and it keeps it curved here, as well as being pulled this direction, it's not gonna kink. If we have this opposite, it could really yank on this line and give me a kink, and that will not be good. So confirm that that's in the right spot. I got my belt attached, got my belt tightened. We always wanna wear these escape packs on the right hip based on how these lines are routed, okay? I'm set there. I'm going to come to my end here. Again, we have our bead and our cutout on our collar. Depress that bead on the cutout. Connect. Okay, again, we have our bead and our cutout there. Depress the bead. Connect. Give it a twist. Lock that in. This prusik cord with our carabiner, I can girth hitch this prusik to anywhere on my harness. And I can connect it into the carabiner so that this will take some of the load. That's a little too long, so I need to shorten that. Another option as well is to just directly connect this carabiner into my harness, okay? So that it tugs on this carabiner and my harness and it doesn't pinch my line or pull my communication pigtail off from my face. Okay, so I'm connected there. We're gonna move to this setup here. When I'm wearing air and communication, obviously I'm gonna need my face masks. So we have our throat mics. You want to wear your throat mic with the con space up, and you want to put it about to the left side of your throat here, nice and tight, nice and snug. Sometimes, there we go. It requires a little bit of assistance, but it's nice and tight to the left here. Okay, I can DC this for now, and this is going to be my earpiece that I want to connect to the left side of my head strap on my mask. So we have a strap on the top, we have a strap on the bottom. Okay, first strap there. On my face mask. Might have to adjust this a little bit so that it's right at my ear. Okay, tighten my mask. This is where I probably need some help to connect this back to my throat mic cord. helmet. Helmet with some kind of light, headlamp. Ear Pro, I'll have that in my pocket or I'll put it in if I'm going to use tools. Eye Pro if I'm not going to wear my mask and my gloves. So now I'm set up to that point. I need to connect my comms. Okay, comms are connected. Before we enter that confined space, we're going to have a tagline. I'll go over that after my mask is off. Okay, so at this point, I'm ready to go. I'm going to do an air check, and I'm going to do a comms check and make sure that they can hear me, I can hear them, and I'm breathing good, clean air. Okay, so after I verified air and comms are good, I want to have somebody attach a tagline or retrieval line to most likely my dorsal connection here on my harness. We need to be attached one way or the other, whatever's convenient, whether it be at the waist, chest, or dorsal. Most likely dorsal, it's easy, it stays out of the way, but we need to have some kind of retrieval line attached to us before we enter that confined space. And that is the basic layout, going from setting up the air, setting up the comms in an organized fashion, to laying our lines out, to connecting to an entrant, properly setting them up so that they can enter the space.